So, Mr. Surgeon General, we are doing a story about child mental health in the pandemic. And there were three major themes that we identified by talking to experts here on the ground. One is that wait times are continuing to increase, that reimbursement rates are not keeping up with inflation. So, private practice people are either getting out of the business or now requiring that they're not accepting insurance or taking out of pocket. And the third is that there simply are not enough people to deal with the demand, and the pandemic has simply exacerbated the problem. So, of those three themes, are you hearing the same thing nationally? And what, as a nation, do we need to do to handle this quote unquote avalanche of children that are in desperate need of help, but are being told on the other end of the phone by their parents, there's no one to help your child. You're going to have to be on a wait list for a year or 6 months.
Well, Kevin, first of all, this is a critical issue, and I appreciate you drawing attention to it. Youth mental health matters not just because it's gotten tougher for a lot of kids during the pandemic. That is a really important reason, and we know depression and anxiety have increased for many children during this pandemic. But the truth is that our kids were struggling before the pandemic as well. Rates of suicide had increased by more than 50% in the decade or so preceding the pandemic. We'd also seen a 44% increase in the percentage of high school students who were saying that they felt persistent feelings of sadness and hopelessness in the decade prior to the pandemic. So our kids were struggling before. The pandemic has made it worse for some kids, especially those 140,000 plus young people who lost a caregiver to COVID-19. And there are a couple of challenges that we've got to meet and meet as quickly as we can. One of them is exactly what you mentioned, the gap in treatment. And the reason that people are having difficulty accessing treatment comes from several sources. One, we don't have enough mental health care providers. We need more. The second is, despite in 2008 passing the Mental Health Parity Law and Addiction Equity Act, which was supposed to bring reimbursements for mental health care services into parity with other traditional health services, that is not being adequately enforced in many parts of the country. And so you're finding that reimbursements are still too low. But we're also, Kevin, not using technology well enough to bring mental health services to rural areas, even to urban areas which may not have the number of providers that they actually need. Technology can be a boon, as we actually saw that during the pandemic, but we've got to make sure that we close the gaps in broadband access and bring these services to people where they are. So I feel a great sense of urgency around this. I'm a dad, first and foremost. I've got two small kids who are 4 and 5. Thankfully, they are well now, but I want to know as a father and as a doctor, as a surgeon general, that if any child in our country needs help, we have the help available for them. And that is just not true everywhere right now.
What do we need to do as a nation to greater incentivize people to get into this field? Because the people that we're talking to say, you can spend all the money you want, but there are not enough people to help these children. The wait lists just continue to grow.
Well, I think we have to think creatively and broadly about the workforce. So when we think about mental health care, we tend to think about psychiatrists, who are an important part of the mental health care workforce, but they are one component of the workforce. And we recognize it takes years to train somebody to be a psychiatrist, and we need more psychiatrists for sure. But we also need more therapists and more psychologists. We need more counselors in schools, where the ratio of school counselors to children is imbalanced, and we need to correct that. We also need to think about peers. We know that peer support groups can be extraordinarily helpful in helping provide some additional support to children, especially when they're struggling. That doesn't mean peer support is a substitute for medical help, but to really get kids the support that they need, broadly speaking, you need a spectrum of support, and peer support groups can be a critical part of that. And finally, community members, family members, and other community members, including teachers, can be important resources here as well. Some communities have taken it upon themselves to train individuals in mental health first aid to be able to serve as a front line, if you will, for getting people help and then connecting them to resources in their community. These are all the different ways in which we can think about building a mental health force, if you will, of individuals across the spectrum who can help people who might be struggling. And finally, just keep in mind the technology piece matters here too, because we know that one of the challenges is making sure that somebody has access to a provider, but they may not be a provider in their community, but they can use technology to have a session or consultation with somebody who might be hundreds or thousands of miles away, but can be present, can provide them with the care that they need virtually, that can be a huge value add. We do that in some parts of the country very successfully. We just need to expand that kind of technology outreach.
I mean, if a child has to wait 6 months to a year to get help, is that acceptable?
No, it's not. It's not acceptable. Our children should be able to get help much sooner than that. If you look at the data, also, you recognize that kids often have to wait 11 years on average from the onset of their symptoms to ultimately getting a diagnosis and then being on the way to get the help they need. That's 11 long, painful years during which a child suffers. And by extension, their families worry about them and the families suffer too. No parent should ever have to go through that. No child should ever have to suffer for that amount of time. That's why I issued a Surgeon General's advisory on youth mental health in December of last year, because we can't wait for the pandemic to end to start thinking about how to address youth mental health issues. Our kids have been struggling for too long. We've got to step up and do everything we can inside and outside government to make sure they have the help they need.
There was a white paper here that was written that basically said the behavioral health workforce is at a breaking point. Is it a national emergency or is it at a breaking point? How would you describe it?
I do think that the behavioral health workforce is strained and under great duress across the country. And some of that is because of pre-pandemic issues where we didn't have enough providers, we had insufficient reimbursement, we had systems which did not integrate primary care and traditional care with behavioral health care, which made it harder for providers and for patients. But the pandemic has made this even more challenging for many providers and for their patients. We're seeing that as people struggle and burn out in the healthcare workforce, not just in the behavioral health community, but in the broader healthcare workforce, that people are starting to drop out of the workforce due to depression, anxiety, and a sense of PTSD, honestly, after everything our healthcare workers have gone through during the pandemic. What I worry people may not fully understand is the implications for us even after the pandemic. If people leave an already thin workforce, then we're not going to be able to get the help that we need for ourselves, for our families, for our kids, most importantly, and that it will compound an already very difficult situation.
I'm sure you've had many discussions with the president about this. Is there anything in the horizon that the president can do to greater incentivize people to get into the profession, to do loan forgiveness, to pay for training, to pay for internships, to help states, sort of prop them up, to give them some help?
Yeah, so this is an issue that's very important to the president. He and I have talked about it in the past, and I'll certainly tell you that he has not wasted time, certainly, in making sure that we're taking steps to better fund youth mental health services across the board. That includes the billions of dollars that actually went in to the American Rescue Plan. We asked schools to actually use those funds to support mental health services, including hiring counselors, and many school districts have in fact used the funds to do that. We also have seen millions of dollars put into expanding behavioral health programs for both mental illness and substance use disorders. We've seen more funding in the administration to support the integration of primary care and mental health services. So a busy primary care provider who recognizes their patient has a mental health need can quickly and easily bring in the help they need, as opposed to trying to look for an outside referral that may be inaccessible to a patient. So this is all in addition to the substantial increase in funding that the president has asked for in his 2022 budget, which will further expand the treatment options that are available to our kids. So this is a very important issue to the president, and he's a parent, he's a grandparent, and it's on that level that we've talked about the importance of making sure that our kids have the help they need. But this should be an issue that unites people across America, across party, geography, across age groups, because well, first and foremost, we've got to take care of our kids. They're telling us very clearly that they need more help. The data is telling that, the stories are telling that. And we've got to step up and not just expand, Kevin, the treatment side, but something we don't talk about often enough is the prevention side as well. We have programs that we know work when implemented in school and community-based settings to reduce the likelihood kids will struggle with mental health issues down the line. We're not implementing enough of those. And that's why in my advisory, I asked for a strong investment in prevention and treatment, as well as an emphasis on eradicating this terrible stigma that still surrounds mental illness and makes young people feel like something is wrong with them, that they are broken in some way if they're struggling with their mental health.
And we just need more people. That seems to be more people, not necessarily more money, but more people as well.
We need more people as well, but I do think that the funding is an important piece of it. If people don't have the funding to support them being counselors in schools, and they don't have the funding to address medical debt, which is a profound challenge right now for many healthcare workers in our country, it just makes it harder for them to stay into the profession. So yes, we've got to pull every lever we can to strengthen our mental health workforce and to make sure ultimately we get services to people who need them.
Right. All right, Mr. Surgeon General, thank you so much for your time. I appreciate it.
Thanks so much, Kevin. Really good to be with you today.
Nice to talk with you. Take care.